Families First Edmonton is a community-based research program led by 15 community, funder, government, and university partners who came together with a shared concern for improving health and social service delivery for families with low incomes. One of the research projects developed by Families First was called Photo Voice, where 10 women were given cameras and asked to take photos that captured their families' experiences and frustrations in accessing health and social services. In this film, we introduce you to 4 of those 10 women.
Just recently, I had my gas cut off, and I went to assistants to help me out with that. Of course, they have to belittle you. Well, how come you didn't pay it? Well, if I had enough money to pay it, I would.
They think they know it all. They think they're up here, and they treat us like really low.
They're rude. They're not nice people when you go there. You know, you ask them for help, and it's like, oh, I have to get up from my desk and do something for you.
A social worker needs to be more empathetic. Like, people need to be more caring and pragmatic, and they're not, and it's crazy.
Originally, the social safety network was set in place to support people who needed support, meant to be temporary. Very easy to shift from that to being a gatekeeper and somehow blaming you if you need it, and you're going to have to prove to me that you need it. And furthermore, if you need it, that tells me that somehow you're lacking in character and somehow you're not doing the right thing with your life. So rather than being a support network, it becomes a bunch of hoops that I have to jump through to get what is really considered in this society part of our rights.
As a social worker, I find the system confusing. You need a lot of skill to sort of understand who delivers what. Families don't care whether it's federal, provincial, or municipal, or a community agency. They know they have a certain need, they know they need something covered, and they need to find it.
There are actually some people, that's their life's work, to try to make the system work as well as the system can for the clients, according to those values, according to those beliefs, and according to those actions, how they treat people with respect. Then you have the worker who's tired. You have the worker who actually believes that the person, all they need to do is pull up themselves by the bootstraps. And those values and those principles, it's nice reading, but not much else.
Miranda?
Mom!
You're not going to the store. No.
It's my money.
Yeah, but you're going to eat normal food. You're not going to be eating...
I'm not going to buy
No,
junk food.
sorry.
You don't even know what I'm going to be getting, so just... You don't let me rip!
Here's my social assistance, and I can actually show you what I get. This is what I'm entitled to pay my bills, my food, my transportation, my clothing, my everything, is this amount here, because the 56 and this here end up being for my rent. If I do not fill this part out, I do not receive a check for the following month. Very important. They know my circumstances, but every month I got a report.
The average citizen always gets concerned about, are my public monies being put to good use? Do the people who really need it, are they really getting it? So it's easy for systems to kind of forget what the program is about or what the service is about.
I have a lot of kids, so it's hard. It's not easy to look after 6 kids, 4 girls and 2 boys. And I have 2 with me, and there's 2 in care. One's on her own, and the other one's on the street. Mom's coming down. Going out of my teens when I had my first child, I didn't know what I was doing. So I was on the streets from when I was 17 going on 18, and I've been out on my own since. They've been through at least 10 different foster homes, maybe more. And Child Welfare just keeps saying to me, Well, it's my fault because they wouldn't believe me that I did not drink throughout my pregnancy. And they don't realize how we're brought up or what we've been through or what we are going through at the time. My dad had this woman come in to babysit us, and well, she beat me up from when I was 6 till I was 14. And she did a lot of damage.
The stories might include family violence, domestic violence, sexual abuse, addiction, and some of the violence that goes with that. Those kinds of things create a situation where people have limited resources to begin with, limited emotional resources, limited problem-solving resources. And then you add on top of that the everyday stress, which brings them to the services.
I'm a single mother. I've raised both of my children on my own. I never had child support or anything like that. So that's usually why I end up going back to the system. I think the reason why I've struggled is mainly because I didn't stay in school to graduate and keep going. And instead, I just settled for looking for immediate work. Since I was 18, I've been in and out of the system. I wish I would have finished school and not had to experience the troubles, and it's very stressful. Sometimes you just feel like you're just hitting closed doors all the time, and every time you try to do something, their rules and their regulations are stopping you. They're blocking you from succeeding.
And then imagine you have all these different systems, and a person may have to go across 6 systems just to figure out, first of all, where they need to go before they do go. And that's just crazy making for anybody.
I'm a single mother, 2 children, 13 and 16. I have administrative background, legal, paralegal background. So I'm currently unemployed at the moment. If I'm capable of doing things on my own through employment, then I don't abuse the system. I leave it for others who really need it. But if I'm really walking in those doors, I really need help. I just used the food bank for the first time since I've been here in 5 years, like 3 weeks ago. Unfortunately for me, I kind of always look like I have money, but I don't.
It's cold outside, you know?
When you're using services, people feel that you have more right to judge. Here she's got limited resources and she's still smoking, or you know, she's got limited resources and she's choosing to spend her money on this when I think she should be spending her money on that.
Sometimes I think it's because of the way I'm dressed. I guess there's a certain stereotype that if you need help, you're supposed to look shabby and dirty or like you're in need or something. Like I said, I've always worked, you don't know my circumstances. Yes, I might have had a job. I might have had $1 million yesterday, and today I don't.
You know, the stereotype that everyone who comes to us for service is down and out, has been down and out, has been traumatized, is deeply depressed and displaced. That's a stereotype. And that may be true of some people, it may be true of a lot of people, but it's not something that we should assume until we find out more about who the person is who's in front of us. Leave your good purse at home, leave your cell phone at home. Yes. I mean, that's just the reality of it. On the other hand, should you have to do that? Probably not. But is it wise to? I would say yes.
You have to kind of rise above those judgments if you find yourself, and then it's more about you. You have to look at yourself and what is it in your background that sort of brings that out in you, because you can't judge like a whole group of people's circumstances by an individual.
You find a lot of the time, like, they act like it's their own money coming from their own pocket, and they look at you like everybody else, like your situation is no different than the next person, and they don't hear what you're saying, you know, they don't want to hear your story. They just think, okay, you're coming to us, you want some money, we don't care why, you know, but they control what they think is going to be best for you. They should just look at you as an individual person, because everybody's life is different. Some people, they abuse the system. So then they think the next person is going to do the same. They don't separate you from the others. There's no compassion there. So you can't expect it when you walk in there, because you're not going to find it. For social work,
There's a gap between the system of service providers and the people who need the help. Somehow the two don't meet very comfortably.
Well, first I have to go to Fort Road to assistance to drop off my report card. And then after that I'm going to the family center for my counseling that I go to help me cope with dealing with the kids. Both of them have been diagnosed with ODD, oppositional defiant disorder. Skylan has been diagnosed with severe ADHD. My son is also severely delayed. He is 12 years old and mentally functioning at 4 to 5 year old level. Miranda as well, occasionally, but has been diagnosed with ADHD, but she's not. They figure that she has a probable mood disorder is what they're calling it now. I've also been told numerous times that she has all of the characteristics for bipolar. They believe she's bipolar, but they're not saying she is bipolar at this time because she's too young for the diagnosis. What? If my kids had a physical disability, I would be able to have in-home support. However, because there's not a visible disability and that they have other disabilities, I don't get in-home support.
A survivor of violence is so sensitive to the behavioral cues of another person because most of the time that's how they've learned to survive. So just by the look on your face, I will interpret that as judgment, I will interpret that as coldness, I will interpret that as you don't like me. And if I'm a survivor of violence, I'm most likely to put a negative interpretation on it.
They may not like me, Chihuahua, because I am very outspoken. When they first took my children away, my babies, they didn't know me that well. Well, when I look at them and they look at me, I think, well, they assume I'm a drunk and I'm an alcoholic.
And if I'm under a tremendous amount of stress, I may even burst out in anger or walk out of your office, because if I'm under a tremendous amount of stress, my tolerance for dealing with the system and dealing with you as a worker, as part of the system, is going to be very limited.
Did you take your meds?
Not yet.
Please. Did you eat breakfast?
Yeah.
What's the rule about eating before having your meds? My daughter is on a medication that's not covered, and so is my son. So basically what we have to do is the doctor has to file with Blue Cross. Blue Cross has to decline it. Then I have to take it to social services. The doctor then has to write to social services stating why the kids need the medication. And then they have to do an appeal process, all to get their medication. And I have to go through this not just once when they need the medication, every year.
The system's almost set up to make it harder for you when you're trying to find that help that you need. And then you have to almost convince the systems that you need that help.
It's very confusing. It's so hard to understand sometimes the way they tell you different stories all the time. I went to the EI office to ask them specifically, if I stay on EI, am I going to have a problem to go back to school? And they said, yes, you will have a problem to go back to school. You have to go, I'll talk to Alberta Works. So I went to Alberta Works and I sat there for 4 hours in the office. And I asked them, can you help me pay for my application to go to school? They say, no, we can't help you because you're on EI. I said to them, if I'm on EI and I apply for September, is there going to be funding? And they told me, yes, maybe there's funding. So I'm getting two different stories from two different places. One saying maybe there's funding, one saying there's no funding.
And actually we've come light years forward. Like we've got healing centers now. You know, we have detox centers now. You know, we have halfway houses. We didn't have those things 30 years ago. So it really might seem like, you know, we're at the bottom of the barrel in terms of who we are and what we're able to provide now. But we've come light years, and that says it's doable. When you look at a big bureaucracy, you think, whoa, you know, how you can get a policy change when people are saying that there's budget restraints? It's doable.
I think that a lot of people have the perception that people that are on welfare are people that are lazy, that do nothing with themselves, and are just in it for a free ride.
155.9. Sent a resume to them, I think it was last week.
My days are spent job searching on the internet, going out there, dropping off resumes.
And I did a parenting class, and I even took my kids with me. And I did an anger management class through them, and that one was 9 weeks. Even though I've been going up and down on the roller coaster, I'm doing good, I think. Like, I know I have a lot to deal with child welfare. Basically, child welfare in the foster home. I do have a lot to deal with them.
I'm at the point now where I'm not going to let them stop me because I don't have any other choice. I can't keep working these jobs like, you know, $13 an hour, $12 an hour. It's not getting me anywhere. This is a copy of the English 30 because I wanted to go into social work, so I needed to take English 30. I'm at the age now where I want to make a difference. I want to feel like when I go to work, I'm doing something to help people. You know, it's frustrating, but I know eventually if I keep trying, somebody is going to help, you know, somebody's going to have to let me in because I'm not going to go away. And that's part of the process, you know, like that's their process of elimination, you know, they want to see how determined you are. So if you're not determined, you're just going to fall between the cracks like everybody else.
Who's at the door?
It's Mommy's fault. There are times where I feel trapped, definitely. You know, like there are times where you feel like, am I ever going to get out of this? Is it ever going to change? Is it ever going to be better?
We say all the right things. Children are our most important resource. People are our most important resource. It's a long way from saying that to actually providing a social support network that really does meet the needs of people.
In my framework and how I look at the world, not everybody starts out from an equal place. So I think there's a collective responsibility on all of us and a personal responsibility to ensure that you make choices where people can have their rights realized.
The body language, the voice tone, and those things I think are so important for the service provider to be aware that when they are providing a service, a human right, that they reflect, that they understand what they're providing, and they have a responsibility to provide it in a human way.